Thank you all for joining us today. I'm David Van Slyke, Dean of the Maxwell School, and I'm delighted to welcome you to this forum. And I hope that you and your families are remaining healthy and safe. This is the latest in a series of conversations with Maxwell faculty members and alumni who are leading experts nationally and internationally on important topics of the day. We are recording this event and will post the recording on the Maxwell YouTube channel, so that Maxwell alumni and friends who could not join us this afternoon can watch it as well. We are delighted to have Steve Hagerty join us for this week's Q&A session with Maxwell students, faculty, and alumni. Steve received his undergraduate and graduate degrees from the Maxwell School and is a member of the Maxwell Advisory Board. Steve is the founder and CEO of Hagerty Consulting, a management consulting firm that helps clients prepare for and recover from disasters. He is also an elected fellow of the National Academy of Public Administration. In 2017, Steve was elected mayor of Evanston, Illinois, running on a platform to expand economic development in all neighborhoods, to strengthen youth development in order to reduce violence, and to maintain diversity through affordable housing. After earning his master's in public administration degree from the Maxwell School in 1993, Steve took a job as a management consultant with Waterhouse Office of Government Services in Washington, D.C. There, he built a multi-million-dollar FEMA practice, and in August 2001, left to work as an independent consultant. In 2002, Steve incorporated Hagerty Consulting. Today, the company is one of the nation's leading emergency management consulting firms, called upon to handle some of the most complex and politically sensitive projects, including managing the $1.4 billion federal community disaster loan program after Hurricane Katrina, helping the New England region develop a catastrophic mass care and sheltering plan, supporting the state of Mississippi in implementing a $280 million alternative housing program after Katrina, and assisting New York City in managing the $8 billion recovery as a result of Hurricane Sandy. Hagerty Consulting works with federal, state, and local government agencies, as well as with a range of nonprofit and private sector organizations. We are proud of Steve's success in both the private and public sectors, and we are even more grateful for his tireless and selfless work to leave his communities greater, better, and more beautiful than he found them. As Dean of the Maxwell School, I know the profound effect that our alumni can have through their public service, and that public service can happen through roles in the public, private, and nonprofit sectors. Steve makes important public service impact from both public and private sector leadership roles every day. I thank him for his great work. I thank him for hiring a lot of Maxwell graduates, and I'm pleased to call him a great personal friend. We are delighted to have Steve with us today. Steve?
Thank you, David. I've got to figure out how to get rid of this show self view because I don't want to look at myself while I'm talking to everybody here. You know, we have a lot more Maxwell grads working for Hagerty Consulting today than we did three months ago. So I'm super proud of that. It was great to wake up this morning and see this on my calendar and be able to wear my Maxwell tie. I don't wear a tie very often now during COVID-19, but I'm looking forward to today's conversation and taking the conversation wherever people want with the questions. What I thought is I'll just give you a real quick, David gave you sort of an overview of my background and everything. I'll tell you a couple things, and then I really want to talk about just some of the key decisions that we've had to make here as what I refer to as one of the best urban ring cities in America. We're not the major metropolis, that's Chicago, but we're right next door. And if you've been to Evanston, Illinois, it's a pretty great and special city. Northwestern University's here. We've got public transportation. We've got, a high school and elementary school that are some of the tops in the country. And we're an incredibly diverse community, socioeconomically, racially, ethnically diverse. And it's a really cool place to raise a family, to have a business. and to be the mayor of. It has its challenges like any job, and some of that will come up now. I will tell you that being an elected official, there is a level of sometimes silliness and nonsense to the job, and some of the issues that you have to deal with, the political issues and things like that. But then there are moments like this where leadership very much matters, where you are, I think, at least I am very glad that I'm in the position that I am in right now. I never imagined when I became mayor of Evanston that I'd actually have to deal with a disaster. I've spent 25 years of my career dealing with disasters. I wanted to work for government like a lot of you do. And when I graduated from Maxwell, I applied to all of these government jobs, about 75 jobs. I had all the rejections for years until we finally had a flood in the basement and my wife threw them out. And I was very upset about it. I said, I don't want to forget these people. And she said, you need to let it go, Steve. You need to let it go. And so I was rejected from all of those jobs. I ended up getting a job for Waterhouse in their Office of Government Services. And after 1 week of training, they sent me to Florida to work on the recovery from Hurricane Andrew. So for those of you that are, my age or older, you'll remember Hurricane Andrew. It was a terrible, terrible disaster in South Florida. And I love the work. I really felt like you're helping people at a time when people really need the help of the government. And sort of at a young age at Waterhouse, I really focused on FEMA and ended up building this practice there. And I was there for 8 years and then left 2 weeks before 9/11 to start my own company. And it really wasn't a company then. It was just I was an independent consultant, as David said. And then 2 weeks later, 9/11 happened. And after that happened, I went right to New York a couple of weeks later and was the federal government's liaison to the fire department, the police department, the Office of Emergency Management, and the city's Office of Management and Budget. And ultimately sort of in charge of the whole outsourced event, reporting to the federal official who was the federal recovery officer appointed by the president and the director of FEMA. And it was the most meaningful and rewarding project I've worked on in my lifetime. I worked on it for 2.5 years. And at that time, when I finished, I was 34 years old. And I thought to myself, God, I'm 34 years old and I don't know if I'll ever work on as meaningful a project as this was. Everybody wanted to help at that time. And you fast forward and, the company that I started, it was just me at the beginning, as David mentioned, is now one of the leading emergency management firms in the country. Prior to COVID-19, we had about 250 people working for the company. Today, we probably have over 400 people around the country. We are in the Emergency Operations Center in New York City. We've got about 100 people there, some in the Javits Center as well when that was up and running. During the Q&A, I can answer questions about some of the stuff we're doing there. The state of Florida hired us right after this. We're working in their Emergency Operations Center and then about to embark on working them get federal aid that they're entitled to. And we're working with big cities at the state of California as well. Governor Newsom has a trifold when he does his briefings every day. It's filled with data and everything else. A bunch of Hagerty consultants put that together every day. And so there's all that going on. 4 years ago, I decided to run for mayor of Evanston. The company was doing well and ran and I won. And my whole premise of running is, part of my pitch was it's been nice helping people on their worst day. I want to help my community every day, which is a nice sort of ring to it if you're running for elected office. And I ended up winning, not by much, by 151 votes at the end of the day. And like I said, I never thought I'd work on a disaster. And so here we are, we're all on a Zoom call that many of us didn't even know this existed 3 months ago, maybe even 2 months ago. And many of us, some are still sheltering in place and some they're letting us, incrementally go out into the world again. what I thought I'd share with you now is just a couple of the issues that have come across my plate as the mayor, and sort of questions that had to be answered. And is there a right answer, wrong answer to some of these? I don't know. We could debate that. But as people who have an interest in public policy and public administration, I think they're interesting. So on March 13th, which is a Friday, everybody remembers, the president declared a national emergency. It's very unusual. The president, it doesn't happen very often. And so he declared it in the letter, and I read the letter from the president. It said, you should activate your emergency operations centers. Emergency operation centers are critical to managing disasters because there are limited resources available and supplies and equipment, and you really need a command and control kind of structure, and you need a structure that's focused on operations and logistics and planning and finance and administration and technology. And that's the standard sort of incident command structure that exists out there. So he declared it on Friday. On Sunday, I had to make a decision about whether or not to declare a local state of emergency here in Evanston. And the thoughts running through my mind were, I think this is going to be bad. We can look overseas and see everything that happened there. We don't have one case here in Evanston. Do I declare a disaster when I have 0 cases or not? And so I went through that and I thought, some people could ridicule me for declaring a disaster when we don't even have any case and overblowing something. But I also don't want to be caught flat-footed. And so I made the decision to declare a local state of emergency. Prior to that, I had sent a couple pieces of communication to the city residents saying, this is real. We need to be prepared. We need to take all these actions that the CDC was telling us to take. And so I ended up doing that, and we ended up activating the emergency operation right then and there. And the emergency operations, we have all these city staff that work in there, and including the city manager and everyone else. I became part of the unified command, which is sort of the decision-making body who decide what are the incident objectives and what are our priorities. In every single day, whatever that incident period is that you set up, you are going back and looking at those objectives. And so I ended up becoming part of that, which was sort of controversial. Like, should an elected official be part of the unified command or not? We are a strong city manager form of government, which means really I'm more like the chairman of the board, and the city manager is the CEO of Evanston. And so one of the other decisions that had to be made is who should speak for Evanston during this crisis. Should it be the CEO, who's the appointed city manager, or should it be the elected mayor? And you might think, well, I don't know, is that really that controversial? It sort of is, because some people say, well, look, I don't want to, you've now given the mayor, I've given myself, because I had the power to do it, emergency powers, okay, with this declaration. And, I felt very strongly that at a time of a crisis, the residents in the community need to hear directly from their mayor. And so, and not from the city manager per se. The city manager still needs to run all the city operations and everything else. So that was a decision that we made. Sort of the next one was next door to us, right? Which we're right next to Chicago. We're sort of an urban kind of community. It's, questionable. Is Evanston a suburb or not? I don't like to think of it as a suburb, but she made a big decision to close down all of the lakefront parks. And so then the question became, okay, Mayor, do you shut down the lakefront parks? I made the decision not to shut down the lakefront parks and to differentiate and say how this is different. It's a fine line, right? We don't, and we're different because I don't think we have all the sports courts and the fields and everything that Chicago has along the lake, but we have a walking path and a bike path. And people's mental health and physical health does matter. And so getting them out and about we have to. But I take some flack for that. I get emails probably every day from somebody telling me people aren't wearing a mask along the lakefront. You need to stand up and show some leadership, like Lori Lightfoot. Shut it down. Even though I could give you the statistics, and the statistics are that our incident rate in Evanston is altogether we have 678 confirmed cases. Sadly, we have 30 residents who have died. That's always going to be a lagging indicator. That's 4.4% of the confirmed cases here in Evanston that have died. The national average is 6%, which is just astronomical. But our incidents, our per capita cases of confirmed cases, and we've always had a lot of testing capacity here because of the North Shore University health system. But we have 80 cases, confirmed cases per 10,000 residents. To our neighbor to the west, which is Skokie, which is slightly smaller than Evanston, about 10,000 less people, theirs is about 120, and then Chicago is 156 people per 10,000. And so I have felt strongly during this whole crisis that like many other governors and mayors in this country, including many folks here from New York, Governor Cuomo, is that our decisions that we make need to be fact-based, data-driven decisions by public health professionals, by experts. We should not rely on some elected politician to say, okay, this is what we should do. Yes, when it's uncertain, then I think, the elected official has to make a decision, or your city manager has to make a decision. But I think it is so important that all decisions be fact-based. I have been very reluctant at a local level to make a decision that is counter to the governor. And so Governor Pritzker here, who I think has done an excellent job with communication and everything else, has very much followed this fact-based, science-based, informed decision making and everything that he's doing. And where it comes down to where the rub hits is you then have mayors that are making some decisions that are different perhaps than where the governor is. So take face masks, for instance. So most states, it sounds like around the country, if you are going into a store or anything, you have to wear a face mask, or if you're doing a grab and go, you have to have a face mask on. But when you're out in public, you need to have a face mask if you can't maintain 6 feet or more distance with people. We're encouraging people here in Evanston to wear a face mask. But again, it's not an order or mandate. Our neighboring communities, our governor did not mandate face masks, and our neighboring communities did. And then I was getting a lot of emails. Mayor, show some leadership. You need to mandate face masks. And again, my philosophy is, fact-based decision-making, and the fact that I defer to the governor's office. The governor has the experts and the resources at a level that we'll never have on a local level. And ultimately, we ended up moving a week ahead because everybody, like 6 other communities in this geographic area did. And because we're regional, because, people's doctors are in different cities, people would cross the line and say to, North Shore Health System, hey, why aren't people, wearing masks here? And so we ultimately decided to do that. So that's just sort of an interesting thing. Real quick, other things is, never waste a crisis. I think that's a Rahm Emanuel saying, and it works in the inverse. You could, as a government leader, say, okay, never waste a crisis. There are things that we need to do that are important, and we need to, get them done now when we have the opportunity. But it works in reverse too, where I have gotten tons of people. There's been a whole effort to ban leaf blowers during this time. And every community, has a thing with leaf blowers, gas-powered leaf blowers. So you wouldn't believe how many people, are like, they're blowing the virus into my yard, Mayor. We've got to get rid of horsepower leaf blowers. We did not. We said, yeah, our public health experts are not saying that that's how the virus is being transmitted. And, their livelihood for these landscapers depends on it. And they were able to still, under the governor's order, be out there. The other one was 5G installations. A lot of emails on 5G installations, which, the science, says that, hey, this is safe, but there are some people out there saying, hey, this isn't safe. That's always been the case prior to this pandemic. But this was an opportunity where we got bombarded by people saying, you need to, under the emergency order, cease all 5G installations right now. Because you shouldn't be paying you should be paying attention to the pandemic and not this. And I guess I'll end with homeless. Big issue with the pandemic that many homeless people are in shelters, and those shelters, they're very close together. There was big concern about the spread of the virus in shelters. And so many cities, Evanston included, opened up hotels to be used as non-congregate housing or sheltering during the stay-at-home order. And we're still under the stay-at-home order here in Illinois, but during the stay-at-home order to provide hotel rooms. It's not cheap. Okay. On the other side, you're providing some revenue to the hotels, which is a good thing. You walk a fine line, in my opinion, in terms of the FEMA reimbursement. We think it's eligible around the country. They think it's eligible. I'll be happy when I see the money in the bank. But there was a lot of push, right, to protect our homeless, not only from one another, but from other people, again, if they were out living on the streets, because ultimately the homeless shelters closed and said, we don't feel like we can safely house these individuals. The interesting thing is then I start to get emails from residents who say, you've spent $1 million on housing the homeless. Why are you helping them when I and other people here in this community need help with housing? So it's pretty fascinating to be a mayor at any time, and it's pretty rewarding, difficult, okay, but rewarding to be in elected service and to be in public service at a time, again, when I think people really need strong leadership and they need the help of so many of us that all work in the government. So I've got many other notes here that I wrote down, but I'm going to stop there and let's get into a conversation.
Steve, that's great. This is Scott. Can you hear me?
I can hear you, Scott.
Fantastic. Great. So we're happy to take questions now for Mayor Hagerty. If the group would like to raise their hand, we'll call on you in order, or if it's more comfortable or if you'd prefer, you can type your message in the chat box and we'll ask it for you. To raise your hand, you use the manage participant or the participant icon at the bottom of your screen, and then you can access the icon to raise your hand. So Jason is up first. I see Jason has his hand up. So Jason, you can unmute your microphone and ask your question, please.
Good afternoon, sir. This is Jason. So I'm not sure if you saw my information in the text. I actually happen to be running for mayor of Frankfort, Kentucky right now. So I appreciate your discussion on the city manager form of government and other challenges that I face here. How has your city pushed back against disinformation, both during this public health crisis and with, you mentioned the 5G, being a steady state, thing that we constantly deal with. Any recommendations? How have you employed JIC locally? Anything along those lines?
Yeah, so thanks for that question, Jason, and thank you for stepping up and running for office. Good luck. We need good people in elected office. So I admire anybody that's willing to do it, because it's not easy. I didn't talk at all about information, and we need to, because this disaster is interesting, right? Every single person first has a role to play in this disaster. To stay home when there was a stay-at-home order, to practice, social distancing. If you're sick, to stay home. If you have any of these symptoms, to self-isolate yourself. And the list goes on. And everybody knows these different practices that by now that we need to do. We are fortunate here in Evanston that we don't have too large a group that is sort of putting out, well, we don't have too large a group that is ascribing to the disinformation that you see out there sort of on the World Wide Web and everything. I get a few emails about it. I've had a few people tell me they're going to sue us because of the stay-at-home order and all of that. But we don't have too much of that. But I'll tell you what the challenge is from a public information component. And public information in this particular disaster is huge, and it is so necessary, because the reality is, if your plan is that the government's going to save me, or the Maxwell School is going to save me if you work for the Maxwell School, or whoever your organization, your church is going to save you, I will tell you, you don't have a plan. It doesn't mean that the government isn't going to step up and do their part. But we all need to have a plan for our family, and to do our part in this disaster. There's something for everybody to do, and you're saving lives, right? And so I think the public information campaigns have been critical. What we've done here locally is we definitely have leveraged what the city of Chicago is doing, because they came out with the whole Stay Home, Save Lives campaign that they had, and we ran with that. And Mayor Lightfoot's been great, as has Governor Pritzker. And the governor they have all these public information campaign materials. So we took all of that, okay, and have been pushing that down. And so that's information that goes out to the public. But the other thing is that we have twice a week conference calls with the governor's office, all the mayors in the state and the state legislators, twice a week with him, the public health director, Dr. Ezike, and usually the IEMA, the Illinois Emergency Management Agency director. And they will talk to all of us. So there'll be 400, 500 people on that conference call. That is about pushing information down. The governor has a daily press conference here in Illinois. We then have a federal conference call, usually once a week, that's organized by the White House, that Dr. Fauci will be on, Dr. Bricks will be on, and we have then a City of Chicago call that Lori Lightfoot has organized with all the mayors in the suburban area of Chicago, and then we have a Cook County one, and then so I declared the disaster on March 15th. That next week, I formed a task force here in Evanston comprised of leaders from all the different sectors, from our senior living area, from the hospitals, Northwestern University, the nonprofit community, the business community, the mental health community. And we formed this task force. There's like 50 people on this task force. We meet twice a week. And the point of all of these meetings is to push down information in a consistent message. And I've got to tell you, even at the federal level, with Dr. Fauci and others, the message is pretty consistent, okay? At the very top, and I don't really want to get into all sort of national politics, that's where the message goes off track. But the message from, the senior government officials, like Dr. Fauci and stuff, coming down, and certainly from the governor's office to all of us mayors, is very, very consistent. And then what I do as a mayor, I mentioned at the beginning that I decided that the residents here are going to hear from me directly, much more frequently than they would in a non-time of crisis. And so I send out I think it's a pretty thoughtful, I put a lot of work into it, email. I did it once. I was doing it once a week. It goes out to 55. We had 75,000 residents here. It goes out to 55,000 people on this mailing list. And interestingly, the open rate prior to this disaster was around 25-30%, which is pretty good actually for those kind of mailings. It's now generally 45 to 50% of the people receiving it are opening it. So people are very very receptive to wanting to get good information But it's critical to this disaster in all communities. But again, we are fortunate. We don't have a vocal group of people saying, hey, this is all a hoax, let's get back to work right now. We don't have that, which is helpful.
Great, Steve, thanks. I've got a question in the chat box, and I've got a few people with hands up. Jeff, I'll get to you next, but the first question in the chat box comes from Ann Stewart. And Ann is asking, and then there's a follow-up question someone else has tagged on, but Ann is asking, what has been your experience with the nursing homes? And then connected to that, another question that's saying, complimentary question to Ann's, as a New Yorker, there's been a lot of criticism that nursing homes did not segregate non-COVID from COVID patients. With your experience working with state government, what types of ability do they have to make those kinds of calls and decisions?
Yeah. Well, Ann, I'm so glad you're on. I love Ann Stewart. She was very, very helpful to me and helping me start my career, as so many people are at Maxwell. So nursing homes is the number one priority. When I mentioned earlier the Emergency Operations Center, which is still active here in Evanston, and Unified Command setting the priorities, the number one priority still is nursing homes. And I would have to imagine that's the case. It should be around the country because it's the most at-risk population. I want to see if I can share no, I can't. I was going to share a screen and we didn't set that up before. So what I'll just tell you is that between 1/3 and 50%, sometimes it even gets to 2/3 of our daily confirmed cases that we get are from senior living centers. The big issue, and I'll tell you a quick story that we had. So we had an outbreak at the first one at a senior living center. We have 17 senior living centers here. Those senior living centers, by the way, are not connected to one another. Okay, they're all sort of independent. And one of the best things when I set up that task force is I took a really strong leader from one of those senior living communities and I said, Mary, I want you to organize all of those senior living communities, and I want you guys to have a weekly work group meeting amongst yourself. And that's not happening everywhere. And that has been great because Illinois Department of Public Health attends that meeting. And so they can talk specifically to officials there about, as a group, what the issues are. But at the very first one that we had 2 residents from a senior living center who were in the hospital. One of them sadly passed away. The other one was ready to be released from the hospital. The senior living center refused to take the resident back. Now, they're a resident there at the senior living center. And I ended up having to get on the phone, the city manager and others, and I was pretty hot about it. And they were hot too. We were all boiling. And their thing was, to Ann's point, like, what kind of plan is this? We're going to take this person who is now able to be released from the hospital, who has COVID-19, by the way, okay? But they no longer need hospital care, and we want them back in their living unit. The deal is this, like, generally speaking, I mentioned the homeless, and we put the homeless there. If you're homeless and you got COVID-19, or you were let's say a resident that lived in a 1-bedroom apartment with 5 family members, there's 800 square feet. If one of those family members gets it, what we know is that if we send that person back home, everybody's going to get it. And now we've got 4 other people that have the infection. And so in that case, we have a non-congregate sheltering program where we will put that person in a hotel. This is common. New York City was doing it. Other places are doing it. We would put them in a hotel. When it comes to people that are in nursing homes, the challenge is, because we would say in that instance, okay, we'll put her into the hotel. Well, this is a person, though, that needs nursing care. And we don't have nursing care. Our hotels aren't set up. They don't have all the equipment. So our public health people worked with them and said, hey, can you clear out a wing or a unit there? And that's where you will put folks with COVID-19. And ultimately, their solution initially was, no, this person's just going to stay at the hospital. And again, I was getting hot because the hospital was reaching capacity and other people needed that hospital. Ultimately, the nursing home took the woman back, and she recovered and everything. But those are the kind of like tense moments that are going on out there. And I'm not necessarily sure, one is right or one is wrong. I mean, I think that the public health experts are saying, look, it is safe for people to isolate in their unit. Now, what we know, and we track this on our situation report that we get every day, we've got about 250 people here in Evanston, nursing staff and residents of those 17 senior living centers that have had an infection with this virus. We have lost 23 of them. So of the 30 people, right, that I mentioned, 23 have come from senior living facilities. So you can understand why it's the number one objective. But the challenge is A, it's their home, and B, how do you provide nursing care in setting up another facility? It's like when they set up these emergency or temporary medical facilities. You have to go and get all the medical staff. So even if we had a location, which we probably could find a location, let's say we took over a residence hall at Northwestern University. They're not using them. They're a great partner. Now we've got to staff this with nursing staff and everything else.
Thank you, Steve. Jeffrey Scruggs is online. And Jeff, if you want to unmute your microphone, Jeff is a member of the Board of Trustees and a Maxwell Advisory Board member. Jeff, ask your question.
Thanks, Scott. Hello, Steve. How are you, my friend?
Hey, Jeff. Good. Nice to see you.
Good to see you. Let me just ask you how you're thinking about the financial impact here. Kind of a two-part question. One, have you done a lot of thinking and planning around any potential assistance from federal government CARES package program, whether it's 2.0, 3.0, or 4.0, whichever you want to call the next one that's expected? And then as you think about the financial planning for the city going forward, I mean, are you thinking in 6-month increments, or are you thinking this is something you've got to plan, a 2, 3, 4 year recovery?
I'll take the second part first. I'm thinking cash flow first. Okay, so the bankruptcies, and Jeff knows this where he works and everything else, but bankruptcies for a lot of these organizations and businesses isn't going to be because of their P&L, their profit and loss statement. They can make money. The problem is they run out of cash. And so that's my biggest concern right now, what I work with the city manager on. So soon after, maybe 6 weeks after, and we knew the financial implication is going to be huge, we extended our line of credit with the local bank, right? So we took out an additional line. We had city council last night. We haven't had to tap that because we have reserves. But what I can tell you is all of these communities that have reserves, many of them don't have enough. Okay, and it didn't even meet the threshold of reserves that they, in their financial planning were saying we need to have. We were slightly below where ours was. Ours should be 2 months of the operating budget, and we were slightly below that. So they're working off their financial reserves right now. The hit to local governments, I can't stress enough how significant it is and will be. I don't think the reports are out there yet, just because it takes a little time for them to do their reporting of their numbers. So the CARES Act, to your first part about the CARES Act, the CARES Act really focused on the first few bills on getting assistance to families, which is critical, and that came in the form of stimulus checks that went to families or to the unemployment and increasing unemployment, and then also using the Paycheck Protection Program to really try to help with employment through businesses so they don't have to lay people off. We did a lot of work with that. Again, the task force that I have in the business working group, working with our banks and everything to try and educate and get all of our small businesses and our nonprofit organizations educated about the PPP so that they could apply. My whole thing is like, I want you guys to be first in line. Like we gotta do this. That first round that was oversubscribed like that, I think we were right where the national average was. Maybe 6% of our businesses or organizations that applied for it got it. Now, the thing that was in the CARES Act, the most recent one that passed, was $150 billion for state and local governments. But here, there was a little twist to it. it only goes to those that have a population greater than 500,000. The vast majority of cities out there and counties do not have 500,000 people. So we're talking, it was a very small pool that got the 150 billion. And I'm a member of the U.S. Conference of Mayors. We're members here at Evanston, the National League of Cities, all of that. There has been intense lobbying going on saying, hey, what about us? Okay. Again, our revenue loss, we think is, I think it's greater than this. The city manager right now is estimating 10.5 million on a $115 million general fund operating budget that we have. Our overall budget is $320 million when you factor in all these other enterprise funds and stuff. So I actually think we're probably gonna, my gut tells me, be in around the 25, million mark. I think the recovery is going to be slower. Even if the government, I know some states, every state's a little different, says, okay, we're open for business, come on back. The reality is there are going to be many people that self-regulate themselves. Say, you know what, I'm not going out to a restaurant right now. I'm going to wait till we got a vaccine and then resume my new normal life. So we get a real problem because we don't have any. In fact, Donna Shalala and I communicated, who's also a member of the board, the Maxwell board, she's a Congress member down in South Florida. And I know she's an advocate for trying to get aid to cities. And the state just passed here in Illinois that they would provide aid, some of that money that they received, and it's a couple $2 billion, that they would provide it to cities that weren't in the 5 counties. The city of Chicago and 5 counties got aid that they wouldn't. Great, I'm in one of the counties that got aid. So I'm working with the county president saying, hey, are you going to push some of that aid down to us? Now, here's the thing. All of those big cities thought that they would be able to use that $150 billion to help with their revenue loss, to help shore up their budget. The U.S. Treasury wrote guidelines that said, nope, you cannot use this for loss of revenue. You can't use this to plug your budget. This is for COVID-19 related only expenses. Well, let me tell you, they turned on the FEMA Public Assistance Program. The Public Assistance Program is supposed to cover a lot of those COVID-19 related expenses. And if you know the program, and we know the program at my company, and I know the program pretty well, there's a tremendous amount of overlap. And so now there's big issues about duplications of benefit and everything else. Cook County, my county, said we got $433 million in CARES Act funding. We think we may have to return a bunch of this money, which is the crux of me going to the president, the county president, and say, well, I could use 18 million. And here's my Evanston returns program and everything else. And I'm still working on it. I haven't gotten anything. But real issues, Jeff. And I worry about cities right now for 2 reasons. One, I worry about their financial condition. And 2, I worry about the psyche, the American psyche right now. And there's been articles in the New York Times and elsewhere about people opting to, move out of the city. We know there's a lot of young people at my company, I'm sure yours as well, where, people in their 20s, maybe even early 30s that aren't married, they've gone home. They're living with their parents right now. And their parents like that and everything else. But they're also making some big decisions about, am I going to return to the city? And maybe this remote working's working pretty well. And companies are saying, okay, this actually works. Maybe we can save an overhead. And so I think we could see a big change to cities over the next, 5 years.
Great, Steve. Thanks. We've got a lot of great questions coming in, so we'll do as many as we can in the time frame allotted.
I'll try to answer them. I'll try to be quicker in my answers too.
No problem. John Spencer is up next. John has his hand up. John, if you want to unmute your microphone and ask your question, please.
All right. Am I on?
You're on.
You're on.
Good. So I am a local port district commissioner and have gotten into a number of conversations about basically what can we do for our residents and our economy. Interestingly, in a group, a workshop discussion with residents real recently, the main theme was not financial, but emotional. And they wanted the port to find ways to provide more social outlets, recreational outlets, and the like. So my question is, what are your thoughts around what we can do for the economy? And also, I'm often looking for how can we partner with our local cities to help them do something for the economy.
Yeah, John, thank you. Yeah, the economy is huge. People's mental and physical health is really big, and I'm worried about people's mental health, and I'm worried about self-isolation fatigue. Right now, again, I added to that task force. They weren't initially there, and then I added mental health to that task force, and they have a working group that's working on this. And some of the things that, again, I'm asking for money from my county for, if they'll blow it down to me, includes, grants that we could give these businesses, okay, to help them get back on their feet, but also, a mental health grant and all of that. I think there's a huge opportunity for all of us to figure out how we create a sense of community when we can't do it the traditional, natural way that we've always done it. I don't know if it's going to be, equal to. I would say it probably wouldn't, but we've got to figure out a way. We've got to figure out a way to do that because we all need to be safe and avoid a second wave. I'm concerned about a second wave. We've studied the 1918 influenza, the Spanish flu here in Evanston, and we didn't quarantine once, we quarantined twice because there were huge, large gatherings after the first quarantine, and there was a second wave. I just think that would break people here. But I also use that as, hey, folks, we've got to stay the course, and we've got to keep taking this seriously. I know how much people are sort of frustrated with the social isolation. And so what we're doing here is, again, for our businesses, we actually started, we got a great group of people here that work for the city. They created a campaign that was picked up and carried across a bunch of different communities, which was Stay Calm, Carry Out. And you'll see it on all the windows and everything else. And that the restaurants have really appreciated that. The economic development department's working, really hard with them. We're looking at closing off certain parking lots and streets here in town so that, again, there can be an outlet for people, like you do a grab and go, but now you can go to this more public area where tables are properly spaced and everything else. There's a lot of logistics we have to work through, but we're looking at that. Our Parks and Rec department is looking at mobile games that we can bring around. So we'd say, hey, okay, we're going to be in this park from 2 to 5 p.m. and it's organized by our Parks and Rec department, and and they can do games and stuff like that. We're looking at the whole summer camp stuff. We pretty much have closed. The beaches still aren't open. We're not going to open them at least until July. Because right now, if things go as planned, come Friday, we will move into what Governor Pritzker calls the recovery phase, where up to 10 people could be together at once. So those are just a couple of the things that we're looking at. But I think there's an opportunity for all of us and just people in general to figure out how can I create meaningful interactions with people when I can't be there in person with them.
Great, Steve, thanks. Next up is Javier Font from the Maxwell Advisory Board as well, perhaps an international call. Javier, you can unmute your microphone and ask your question.
Hi, good evening. Great to see you. Steve, congratulations for your very impressive leadership during this crisis. One of the lessons we can learn from countries like South Korea or Taiwan is the very close partnership between government and private companies during this crisis. Based on your very remarkable experience, how would you rate the partnership between government and the business sector in the US during this crisis?
Javier, it's great to see you. Thank you for being here. Javier and I were classmates at Maxwell for our MPA many, many years ago. I don't know if I have enough perspective, because I think that large companies in this country have played an important role on the supply chain. Although I know there are lots of issues. PPEs, we didn't really talk about PPEs. That is a huge issue. It's getting addressed, I believe, because I'm hearing less and less about it. That was a huge issue for senior living communities. Okay, was the lack of PPEs. The hospitals, obviously New York City had huge issues with this, but around here. And so I will tell you, in my, sub task force meetings that I've had with the business community here, everyone here has been on the same page about health and safety first. My business is important. I need to figure out how I operate in this time. But health and safety is important, because I think, again, a lot of the business owners are smart enough to know, like, we don't want a second wave of this. We don't want to have to go through another 2 months of shutting down and having, no revenue. I've also seen ingenuity of businesses. We've got some 3D printer companies here in Evanston, and they moved quickly to produce shields that are in a lot of our stores and our restaurants that will, slowly start to open, and they need to have those to protect their employees. So I've seen a lot of ingenuity, and I've seen a lot of teamwork. I've seen restaurants and others really share what each other's doing from a marketing perspective, and so forth. I think, honestly, that one of the big issues, and I think the private sector could have helped more with this, but the government didn't really call for it. There was the issue on the PPEs, but the other issue, remember, is about contact tracing. One of the reasons that I think our per capita infections here are lower than Chicago, for instance. Remember, they're like 156 per 10,000, and we're at 80 per 10,000. Chicago abandoned contact tracing, and they may have, because it just became overwhelming. Okay, and I get it, like thousands of cases and everything else. Contact tracing is foundational to managing any kind of pandemic. It's anything, West Nile's virus, you name it. You do that in public health. And it was shocking to me to learn, only a couple of weeks ago, that people weren't doing contact tracing. We've been doing it since day one. And we used and called upon a whole bunch of volunteers that are part of our Medical Reserve Corps, okay, to help do contact tracing. It's not rocket science. But I honestly think Chicago or some of these other big cities where they're not doing it, I don't understand why somebody didn't say, hey, let's call up the private sector, the right, entities, and say, we need you to help us stand up a contact tracing program. And it wasn't, to my knowledge, used in that capacity. But I think New York has been doing contact tracing, and it's critical to us managing, especially as we come out of the stay at home. We know there will be outbreaks, okay, but if we don't have enough testing, okay, and then contact tracing, we could be back to this. I used the analogy when I communicated to the community a long time ago, the board game Chutes and Ladders. You ever played the board game Chutes and Ladders? It can be maddening at the end because you're about to hit the finish line, and all of a sudden you hit a chute and you go back down to start. And that's the way this disease is. It's not like, oh, I go back a couple steps. It's like, no, if we screw this up, we go back to the beginning and we all lock down again.
So Steve, I've got about 6 more questions. I want to be respectful of your time. If we need to cut it, I can go with one more, or we can keep going.
I'm good, Scott. I've got something at 1:30.
I will be respectful and do what you can do. Thank you. Janice is asking, you mentioned the university hospital system increasing local capacity for testing. Mm-hmm. What are some other ways that you think TownGown Relationships can offer benefits within a college town?
It's a great question, Janice. So just a little more on that. So we have North Shore University Health System, which is partnered up with the University of Chicago. It's their medical school, and then Northwestern is downtown Chicago. we were blessed in this area because we have such a great healthcare system. We also have another one, Amita St. Francis. And North Shore in particular was one of the first to have a test up and running. And then they kept adding more and more and more, which meant a lot of our population, the most severe or showing symptoms, could be tested initially. So that has been a huge help in their partnership. And on that mayor's task force call that I have, they report out, the presidents of the hospital attend that, and they report out to the entire group, here's what our numbers are. So everybody in the community knows what it is. Another area where universities were called to action or standing by, in this case, Northwestern very much was standing by, is we were worried that if our hospitals became overran, right? And that's why we've all done this work to slow the spread. But if they were overrun, we were going to have temporary medical facilities that we were going to have to create. Now that was set up here in Illinois by the state. But I had a lot of people, again, coming to me saying, Mayor, you need to set one of these up. And I'd have to say, well, no, the state's taking the lead on that because, again, hospital systems are regional. But there were plans, and I'm sure this happened in other places. We never had to execute it here in Evanston because we never tipped on the capacity. We got close, but didn't go over with our healthcare system here. And that came at a big price. I mean, they shut down all elective surgeries and everything else. I mean, they are sucking wind financially. And I think that's actually another huge issue that we have to worry about as a country, is the loss of capacity of healthcare systems that aren't going to make it, that are going to go bankrupt during this. And I think you'll see a whole conversation about that later on as time goes by. But they were going to be helpful there. The other two ways that I'll just give you that Northwestern has been helpful to us is one of the big issues we saw off the bat was food insecurity. So we run the free or reduced lunch program at the schools. When the schools closed down, we set up a system so those lunches could still be served. It was shocking how many people were coming and we ran out of food. And so we set up a city-run pantry. One of our aldermen who's really focused on this and others in our city set this up. And it's such a needed service right now. In Northwestern University, even though they're really sucking wind too financially and all their students have gone home and there's huge implication to them, they have stepped up financially to help fund that program. And then the last program I'll mention with the university, and it relates to John's question too, about economic development and how you can help. They have set up through the Kellogg School of Management a program that works with our small businesses here, and they may expand it to Chicago and elsewhere, and provide some strategic planning advice, cash flow management, digital marketing. How do you market when people are coming into your shop and all of that? And so they've set that kind of mentorship program up.
That's interesting, Steve. Thank you. Darren is asking, from your vast experience, what is the most common mistake cities make in terms of lack of preparation prior to a disaster? In other words, what is the most common unavoidable or unforced error?
Yeah, I think lack of using an emergency operations structure. Honestly, I would be surprised if there are a ton of other cities our size that have their emergency operations center up and running and are really operating and following the national, the NIMS process and the ICS process. And you could Google that and look it up. But here's the example that I'll give you is when we first started this pandemic, if you think which federal agency was in charge, this was a public health emergency. HHS was the agency that was in charge. And I don't know if a ton of people took notice of this. I do because of our business and what we do. But the president made a decision a few weeks into, as this was really ramping up, to remove it from HHS being the lead agency, because HHS is a public health agency. I mean, yes, this is a public health emergency and the operations are public health, but the coordination, the decisions that have to be made, again, who we're providing ventilators to when we don't have enough ventilators and who we're providing PPE to when we don't have enough, that moved over to FEMA. And the structure that we follow here, well, it's at a much smaller scale, is just what the federal government follows. And the thing is, most cities are probably just, trying to manage this disaster or not really paying attention to some of these issues that we're talking about, food insecurity and mental health and all of this others, because of in the senior living communities and all that, because they're not in this structure. And again, this structure creates a unified command. That command is myself, the city manager, the public health director, the fire chief, and the police chief. I will tell you, if you're a city and you're listening, you're like, oh, I wonder how we do this. The fire department is critical to this. They operate under incident command all of the time. And they were incredibly helpful, because otherwise our city staff isn't used to this structure. Even though we're a certified emergency management department, we've got one emergency manager, a division chief at the there. So I think that is, and the second thing is, I know, because I've been in this business for 25 years, what the value of that task force that I set up, the pandemic task force, I knew what the value would be. I don't think, I'd be surprised if there are a lot of communities that do that. We come into communities all the time, and they have not gotten all the leaders together, in a task force like this, so they're all on the same page. I preach to everybody, this is a whole of community response and recovery. It gets back to what I said earlier. No one person or entity is going to save us. Like, we're all in this together, and we need to be coordinated and work together. So I'll just we'll leave you one final example of the value of like that kind of task force for communication and for unity is our faith community. I have our faith community as part of this task force. And, the leaders of our faith community, even though they're opening up now or will this weekend to 10 people, are pretty much, saying, no, we are following, fact-based, science-informed decision-making that's going on by our governor and other people. And we're not going to be pushed by, the president or other people that are saying, yeah, churches are fully open, let's get everybody back there. And there's real value in that.
Steve, great. Connected to that, perhaps, we had a question of your incident command center has been up for a very long time. Any tips on keeping everyone engaged and being consistent with that?
Yeah, so great question. So if you're in the midst of a really intense disaster, let's just say 9/11 or Superstorm Sandy, that incident period is 24 hours. And so every 24 hours, you're going through the structured process that's part of the NIMS process. And so to keep it going as long as we have, we've expanded that incident command period or incident period. So the situation report, and I've got it right here in front of me, that situation report now is produced 2 times a week. Okay, and when we were first starting, it was produced every day. Okay, and it's hard to keep that pace up. Part of this creates a rhythm for you, okay, and it creates a structure. People take on new titles. Our facilities director is our logistics chief and everything. And so you've got that. The other challenge that you have with this disaster is we can't have a bunch of people together. I mean, we are at as much risk as anyone else of getting this, and that could really cause problems. And so initially, we were at our standard EOC, which is also a joint operation between Northwestern and the city. We have a mutual aid agreement in place for many years where we share a emergency operations center. So Northwestern's also part of the EOC, which is the largest employer and largest entity here in town, who has a lot of muscle and can help us with a lot of things as part of that. We were there, but it was too small. So we moved to this new facility that we were about to open, this $53 million community center. Everybody's excited. And we took that over as the EOC. We're about to vacate it. What we started to do is we would meet there 3 days. We were meeting there initially every day, then 3 days a week. And now we only meet in person 1 day a week, and we do virtual EOC on the other days. So that's been effective. And again, I think we've got a rhythm now, and the pace is more even keeled now that we've gotten through the concern about PPEs. We've got, a plan, for our senior living communities and what's going on there. So Yeah, it's a great question.
Steve, 2 more, and I think we can get you out at 3:15. Is that okay?
That's fine.
Awesome. So let me just get to the right spot here. Sorry. Shoot. Here we go. Steve, could you please speak to the issue around how this pandemic has affected the community of color and what steps have been taken to protect those who have disproportionately been affected? Have we seen any new policies being implemented from federal or local level to address both protecting and recovering from the disaster and any future disasters of this nature?
Yeah, so great question. I mentioned at the beginning that Evanston, one of the things I love about Evanston is a very diverse community. Our numbers are showing the same level of health disparities that you're seeing in other big cities across the country. So, we know that for a fact that just our structures and our inattention and non-committal to investing in underserved communities is, it's just very in our face right now to see this, and it's very upsetting. What I'll say is that from an immediate need, like what we can do, what we did here is work with the governor's office to open up testing at the federally qualified health centers, okay, which are critical, and they exist around the country. And we have one here in Evanston. It's called the Erie Skokie Health Center, and it serves primarily Black and Latino population, so it was critical that we get testing there. And the other thing is we got mobile testing, and we're about to do this actually next week, mobile testing that will be in areas that are predominantly Latino and Black here in Evanston. Now it's important to increase our testing, okay, in those communities, but the reality is that doesn't take care of the underlying problem. The underlying problem is, one of inequity. And we have been working as a community on sort of equity and empowerment and our schools were really the leaders in this because of the achievement gap and everything that we have here. They've probably been working on it for a good 8 years, probably 10 years that they've been working on it for a long, long time. As a city, I'd say the last couple of years. But it really means that we have to, double down on what we were doing prior to COVID-19 in terms of, the healthcare that we're offering to our minority population here in Evanston. And honestly, so much of this is tied to economics and the economy and good jobs and all of that. And workforce development's been a big focus. It was sort of one of the 3 things. And when David introduced me, the second was about sort of youth development and reducing, violence that we have in the community. And we don't have a ton here in Evanston, but we have some. And a big focus has been on workforce development. And so it's a super, as many professors and others on this call know, it's really, really complicated. So in the short term, we've been doing that. I will also say, remember, I'm talking to the president of the county. I'm trying to get funding because I can use that coronavirus relief funding if they would pass some down to us to provide more. I want to create some kind of program that's helping at least initially, with healthcare for our lower income population, which here in Evanston tends to be of color.
Steve, thank you. One last question, and I'm sure Dave, when you're done, David will come back on and thank you for this great session. But we have, I believe it's Anthony asking us, could you please discuss your initial employment search struggles, any advice or wisdom to pass along? We have recent grads and some perhaps even current students on the phone, but then also let me fold into that a question from our career services team from Lauren. And you know Lauren well because you're here helping our students all the time. So connected to that, Steve, great to see you. Any words of advice for our new graduates that may be helpful to find work in the climate of COVID-19? Are there any sectors or areas of the world or that you see opportunity for our Maxwell grads?
Yeah, great. Thank you, Scott. So let me start with some positive news for the Maxwell grads. So at the task force meeting, and I'll keep talking about it, that I hold twice a week, I have a spotlight at each one. And so one spotlight might be on mental health, food insecurity might be another, one might be on contact tracing and how do we do it, and all that, because I want to educate all these leaders in the community on that. So I had a really notable Northwestern professor join recently, and his area is in the area of employment. He's a macroeconomist, and he spoke about the amount of stimulus that is out there and money that is being saved right now, that economists are really looking at the savings rate. And at a certain point, when we get to that point where we can be out more and everything, it is going to get unleashed. And when it does, there's going to be a lot of money going into the economy, and that should be, good for jobs and stuff. So I share that with the young people that are here and go, oh my God, I can't believe I'm graduating in the midst of a pandemic. When I graduated in '93, there was sort of a little recession, but it wasn't this. It wasn't this. But I would hope that the young folks that are here and listening realize that the world just changed. And I'm 51 years old, and I had one other moment of this that I can think of in my lifetime, and that was 9/11. When 9/11 happened, you knew the world was going to change. You didn't know how it was going to change exactly. The world's changing right now in the midst of this, and we'll see what direction it goes in. I think there could be some really positive aspects of the direction that it goes in. One that I think is that, and I always hope this, but I think it could, is a call to public service, really seeing the value of people from all different backgrounds, right, and the value that they can provide in the federal government or the local government or state government. I also love the fact that I don't like anything about this disaster, but I love the fact that essential workers right now run from people that have PhDs and are scientists and they're helping us figure out, a vaccine to this, to your grocery store clerk, to your sanitation worker, to the healthcare worker that's at the nursing home. I mean, it's scary, some of those jobs. I mean, that is courage that people are showing to go there when they're worried about their own health or they're worried about the health of their family. I think that's going to be good for us. And I think it's shining a light that we're all in this together, that the role or the profession or the job that each of us has matters. And so I'd like the young people that are just starting off in their career to remember that. You never know, where your journey is going to take you. Again, I wanted to work for government. That's what I wanted to do. I applied for all those government jobs and I didn't get any. And yet I'm so grateful for, the journey that I've had professionally. And I just think that I know that Maxwell sets you up really nicely to have a really productive career and one where you're really making a difference. In terms of my initial search, all I'll leave you with is I applied for all those jobs. I didn't get any jobs. And so I decided that it was my resume that was the problem. And so I got rid of my one-page resume and I created a 4-page resume. And on my 4-page resume, it was one piece of big paper that I folded in half. And so you opened it up and all my experience, my vast experience at the age of 25 was listed on these 2 sheets. And then you looked at the back and it had all my important references on the back. The front cover of my 4-page resume had my name, Stephen Hagerty. And by each letter of my name was an adjective that described who I was. And my last one for Y, for Hagerty, was youthful. Because that's exactly what employers want. They must want youth. And so my last one was youthful. And it was that resume that got me an interview at Waterhouse. And I interviewed there and ended up, let me just share what it was. I ended up interviewing there. And the last interview that I had was with the most senior person that I was interviewing with, who's a director. And he looked at my resume and he said, "Steve, I see that you graduated from Maxwell in June. It's August now. What have you been doing?" "Oh, well, I've been taking some tennis lessons," which is true. And I said, "My brother and I have this loft business." So he goes, "Oh, loft business? What's that?" So I explained the loft business to him. The dorm rooms are small. We'd raise the bed. We made some money and everything else. And it was a great business, but it was really cyclical and it only lasted about 2 weeks. And that was the end of your business. But we built 50 of these and we made money for spending money in books and all that kind of stuff. So the next day they call me and they offer me a job. So my first advice for you, unless it's my company that's calling you and somebody offers you a job within 24 hours, you should ask for more money. You may not get it, but there's nothing wrong with asking. They must really want you if they're offering you that job. I didn't do that. I was so excited that someone wanted to hire me. I just accepted the job. Second thing is I started Price Waterhouse. I mentioned that I had 1 week of training. The very first day, that evening, there was a reception at Price Waterhouse. The director that interviewed me was a guy, Dave Ziski was his name. Dave at the reception says, "Oh, Kevin." There's this guy, Kevin Bacon, who likes to say he was born 6 years before the Kevin Bacon we all know. But he said, "Kevin, I want to introduce you to Steve Hagerty." And Kevin turns around and says, "Steve Hagerty?" He says, "You're the loft man I heard about. Wasn't your good grades that got you this job or your extracurricular activities or your leadership. It was your entrepreneurial spirit." Now, the funny thing is, I didn't list the loft business anywhere on my resume. It only came up because he said, "What have you been doing since you graduated and now you're interviewing here?" So I share that story with you because I want you all to know that you are much more than your resume. When you go into an interview, make sure to let them know who you are, because I didn't think of myself necessarily as an entrepreneur. That's who Price Waterhouse saw when they hired me. And indeed, I am an entrepreneur. I just didn't know it.
Well, Steve, just want to really thank you for this presentation. And I want to summarize some of the things that I heard, and I'll do so quickly. One of the things that became really clear as you were talking with us, and again, we know that you're really busy, so these almost 90 minutes are really appreciated. But I think what you've demonstrated for us is how important leadership and discretion are, and that whatever you're doing, you have to both balance the building of confidence with a desire for accountability. And what's clear to us, I think, in all the individuals that listen to you today is that you have a real orientation toward both citizen engagement and public participation, and that you've taken that seriously as a value. One of the things that came through loud and clear, and I know this from you because we talk so frequently, but I think all our listeners got to hear today is you need to have a thick skin. And a commitment to something bigger than yourself, because if you let your emotion and the personal attacks on you get the better of you, you're not going to be able to achieve your vision. And what's clear is you have a vision. In some ways, I think you must be right now one of the most unusual mayors at the city level in the nation. And so in many ways, not only is your commitment to public service strong, but your situational leadership is probably much stronger than many. I have no doubt that part of your challenge is how you balance all the different demands on your time, including from others who want to learn from you as we wanted to today. I'm really impressed with the way that you talked about the balance you're trying to strike between the intergovernmental dimension, giving a lot of credence to federal agency leaders, to state elected leaders, but also your constant coordination with other city managers and local mayors, and how you use different organizations like the National League of Cities and the U.S. Conference of Mayors to do so. But what's also really I think refreshing is that you have such a consistent, and what I interpret, because I'm a big fan of yours, an intentional approach to communication. Clear, consistent, accessible, transparent, and maybe for some people's taste, a too candid approach to communications. But I have no doubt that that's why lots of people tune in, and the open rate is up to 45%, because people value the fact that you're speaking to them in a language they understand without all the acronyms that sometimes can cause us to have our eyes glaze over. Of course, you know that the Maxwell School is so pleased to have you as an alum, as an advisory board member, but it's great to hear you talk about it's important to take an evidence-based approach, but it's also important to exercise patience, to show humility, and to find a balance. That data is really important. Decision-making in the absence of data can often be a disaster. But the failure to make a decision because you still have incomplete data can also be a disaster. And I think, one of the things that I really appreciate is the way that you've struck that balance. So let me just thank you, Steve, one more time for joining us today. This was really great. And I also want to thank Maxwell's outstanding information and computing technology team for supporting this talk. I'm grateful to the staff of the Maxwell Dean's Office and Jessica Murray, our Director of Alumni Engagement, for organizing the event. And I just want to remind those that are still on this call that next week we'll be hosting 2 different Q&As with 2 of our longtime and most famous professors, Professor Bill Copeland on Wednesday, June 3rd, and on Thursday, June 4th, we'll be with Emeritus Professor Bob McClure. Electronic invitations were mailed yesterday, and we hope you'll join us for what will no doubt be additional interesting and engaging conversations. And if you have any questions or suggestions for future topics, specific faculty you'd like to hear from, please don't hesitate to email Scott Barrett in the Dean's office. And to all of you, thanks so much for joining us. Thank you, Steve, very much. Please stay healthy and go Orange.